Let's go ahead and address the very first clinical pearl/question. So something very common that we get asked is in regards to our nutrition panels, should we stop our supplements or medications, even for some of our other panels, prior to testing? So do we really have to stop it before we test? What's that whole?
It's a good question. It's a question we get all the time. And, I think it's important to understand that there's this difference between this concept of a medication or a supplement that influences versus something that is an interferent. And so I'll explain that a little bit. So if something is influencing the test, that at the end of the day means that the biomarker result may look a little bit different than it normally would have. It might be a little bit higher than it normally would have, or maybe a little bit lower than it normally would have if somebody wasn't taking something. So that's what a medication or supplement that influences might do. An interferent is actually something that is going to halt our ability to run the test. Ultimately, at the end of the day, we won't be able to provide a result. So that is a good distinction to make, what this difference is between interference and things that might influence the test. And that can lead into, maybe Patty, you want to talk about whether clinicians should stop.
Yeah, and to the overall question, first and foremost, Genova never recommends that anyone stops any necessary medication to do testing. That's completely up to the clinician and to the patient. However, the answer is, to Michael's point, you don't have to stop medications. And in fact, a lot of clinicians choose to keep their patients on their normal supplements and medications just to either see the efficacy of their treatment, just kind of get a status of where they are. So if you're going to stop a medication, recognize that, if it's an interferent, we can't run the test if you're on an interfering medication. But the influencing ones, understand that it may not fit into the reference range. And if you keep someone on one of these influencing medications, it might be helpful to call us here in medical education so we can walk through that test with you as it relates to the clinical picture. But because this question comes up so often, what we've done for our big flagship products like the NutrEval or the GIFX is we've developed something called the test prep page. And if you go to the product page for the NutrEval or the product page for the GIFX, off to the right, you'll see additional resources. And it's the bottom link. You just click on test prep. And what we do here is we literally lay out what we know about certain medications and or supplements and how they might influence the test, understanding we don't know how every single medicine is going to influence results. I mean, our answer 9 times out of 10 is we're not sure, but based on biochemistry and some literature, we're able to kind of give some guesses as to how it may influence.
Yeah, and an example might be, for example, digestive enzymes, right? So if somebody's doing a GI test, they're doing the GIFX stool test, and you're having them continue their digestive enzymes, that might be something that's an influencer where you would be expecting and hoping that that digestive enzyme is helping the patient break down and absorb fat, break down and absorb protein a little bit better. And so by having them stay on that medication, you may get a little bit more of a false normal reading because the enzyme is assisting in the digestion and absorption process rather than if you were to take them off of that. And that can give you information. It can tell you, oh, actually the digestive enzyme is working. This is falling within normal range. That's what I'm wanting. Or you can have them come off the digestive enzyme, and that's more of an evaluation of what they're like at baseline. That's in contrast to something like charcoal. If a patient is on charcoal and we do the test, then essentially, oftentimes that will change the entire color of the stool sample, making it difficult for us to identify things like parasites under the microscope. So that's what we might consider to be more of an interferent. And that's just a little example to explain why it's important to know what things would be an interferent as compared to an influencer, why this page should help.